get started with this week's seminar. Today we have the honor to have with us Dr. Caleb Banta-Green. I just had a chance to chat with him. It's very definitely interesting background that he has. He worked on social work, then he moved on from Masters in Public Health, and then he got his doctoral degree also here at the University of Washington. He has done a lot of work in the area of drugs as well, but now he moved also to this issue of municipal wastewater, and it seems to be a project that attracts him over the time. And he wants to move to something else and come back to work with this project. So I'm sure we're going to have a nice time, and very, very welcome, and thanks for coming with us.
Thank you very much. So good afternoon. Thank you for having me here. Can you hear me okay? If I see if I can maintain this pitch. So yes, I'm actually going to talk about wastewater, and I'm going to talk about it as a population measure of hidden health behaviors. And as we were discussing, I really mostly do intervention research around overdose prevention. Working on this epi thing, and I can't kind of stop. So I keep trying, but I keep coming back to it. And so my goals are pretty simple. I just want to pique your interest in this measurement approach, which maybe you already are here, so that helps. And as I like to say, the puns alone are worth it. Believe me, I get all of them. And I'd like to get a little input on some methodological issues that I have in the upcoming proposal, and if not actually getting them here, but if people think about things, ruminate, and want to contact me, I'd love feedback. And then have some discussion on any applications potentially of this methodology to your areas of interest. All right, those are my grand goals. So I'm going to talk about sort of where this interdisciplinary work came from, the catalyst for that, talk a little bit about drug abuse indicators. I'm going to try not to talk about drug abuse too much because I'm trying to keep this a little bit broader, but I think some of the motivations there may or may not be relevant in your line of work, so I do want to mention that. Talk about the rationale for using wastewater treatment plant sampling, a little bit some of our findings, some of our ongoing research, and future opportunities. So, this is a fancy way to say I got a cold call. So I got a cold call for an environmental chemist. I can't remember if it was 05 or 06, and she said basically, I just tested the wastewater in Corvallis and there's a bunch of methamphetamine in it, and I have no idea what it means. And I basically said, oh, that's awesome. I said, I'm a drug abuse epidemiologist. I'm looking for a reliable, quantifiable measure of a population drug use. So I like to call it the peanut butter meets chocolate thing. And the background was that her husband's a traveling pharmacist. So he was going around all these communities, rural and mid-sized towns in that area of Oregon, and he was just seeing meth really ravaging the place. So he asked her, so people usually use wastewater sampling to look downstream for environmental health reasons, to look at downstream effects. And so this confuses everybody. It confused an editor 3 times at AJPH. And I never resolved the confusion. I'm looking upstream at population behaviors, not downstream at environmental effects. So she usually looks downstream. You know, what is all that stuff in your Gore-Tex that you're spraying on your jacket doing to the fish, right? So she got interested in this for sort of a roundabout reason. And it kind of resonated with me because I had a very old immunology degree, so I had a little organic chemistry somewhere in there. But I've been doing some work with the medical examiner and then in turn with the state toxicology lab. So I was used to looking at individual people's results for drug tests, right? And so this is just a big giant pooled drug test. So I had a little bit of knowledge around sort of parent drugs and metabolites and ratios and that kind of stuff and how to interpret that. So anyway, we decided just to kind of go for it. And this was also in the context of I had been hired in 01 to take a drug trends tracking approach that had been used in Seattle. And the director of the state substance abuse unit contacted the institute where I now work and said, you know, we've been tracking drug trends in Seattle for 25 years, but methamphetamine is everywhere. And so we want to ramp this up and scale it up for the whole state. And so I went out to 13 different counties. I started epidemiology work groups, and I talked to local stakeholders, and I tried to pull together different data. And it was all really interesting, and I learned a lot, and I made great contacts, and then I came back with completely non-comparable data across places. And so that was really another big motivation for me, was that. But what I also learned, and I think I put it in my little blurb, is that people want their data. They don't want to know what's happening in Western Washington. They want to know what's happening on the Port Gamble-Squallam tribe. Right? They don't even want to know what's going on in their county. They want to know what's going on as close to their area as possible. And there's a lot of variability and a lot of different health behaviors, drugs being one of those. Okay, So quickly, a little bit about drug abuse indicator data and some of the measurement issues. So why do I think it's important? We want to detect sort of these emergent and dynamic drug trends. Things are changing a lot, whether it's methamphetamine or prescription drugs or heroin. There's just a lot of things going on, and things fluctuate quite quickly. Supply and demand can vacillate. There's lots of substitution effects and so on. So there are persistent drug trends as well. So we want to look at prevalent issues. We don't want to just focus on the new and novel and shiny. We want to look at the big issues as well. I don't want to just look at the new formulation of OxyContin. I want to look at heroin, right? They're both important. And of course, I don't have to tell you this, why is money and resources and all those things. So some of the current limitations in my line of work, you can think about where they line up for you, we do not have very good geographic resolution. Most of the surveys are national level, maybe state level estimates if you're lucky. Temporal resolution is quite bad. It's usually annual data, and availability is generally terrible. It's like 1 to 3 year lag, which in my line of work is irrelevant, essentially. Population coverage is always a big issue. As an epidemiologist, to me, that's really the biggest issue. With substance abuse, depending what sample you use, what approach, large portion of drug using communities are currently excluded. Oh, we're gonna exclude people who are hospitalized and incarcerated. Well, that's a big deal if you're actually trying to understand something about substance abuse, for instance. And in a smaller community, you may have a small number of actual events, and then you're starting to suppress data, and you have all the issues with small numbers. So those are just some of the things that we're trying to address. Very briefly, in terms of some of the measurement bias issues, to me, the only real true population level data are mortality data. They still have problems, but they're a tip of the iceberg data source, right? And they are the ultimate lagging indicator. They're the definition of a lagging indicator. In current surveys, when they're used, usually rely on self-report, and again, it excludes some of the most important populations, at least in terms of high acuity drug users. ER and overdose data are generally only available for large cities. And things like poison control centers, which is kind of interesting as a front-end, emergent, new issue phenomenon, but they're not good for prevalence measures because once people learn how to deal with a methamphetamine overdose, particularly medical providers, they stop calling the poison center. I should also say, I should have said this at the beginning, I'm going to go till about 1:15 and allow time for discussion, but if you have clarifying questions, which you may well, please wave your hands around or however you'd like to get my attention. Okay, so did I skip one or not? I did not. So I'm going to give you some examples of geographic and temporal variability. Just 2 slides just to show you the types of things that happen with my particular content area of drug abuse. So this is Washington. These are old data. But this is county level, upper left. This is the fiscal year. These are adult treatment admissions for methamphetamine per 100,000 population. So you can see how rapidly methamphetamine expanded in Washington state. So, you know, a year is not a bad measure. Annual measures are okay, but you can see pretty rapid measures and really strong geographic trends. So here you have, obviously, time and place are getting displayed together. This is my spaghetti plot of deaths. Deaths are really interesting, but I just mentioned, you know, counts and small numbers of events. There are about 250 drug-caused deaths per year in King County. I think that's about 10 per 100,000. And that's out of almost 2 million people. So not a lot of events. And then you get all sorts of weird things like methamphetamine, which has a fairly high prevalence, happens to have low acute toxicity. So it's not a very good measure. And they don't even report cannabis in mortality data. So there's all sorts of problems with mortality data as an example. But you can also see that things change pretty quickly. This is cocaine. So I wouldn't want to be, oh, I'm going to do a validation study. I want to compare this measure of cocaine with this measure. Well, you better make sure your times line up very, very well because things can change very quickly. What else do I want to say?
Sorry.
Yeah?
On this slide, is this, how do you determine those numbers? Because it says they're time to drug identified. So is this basically looking at how often you find traces of the drugs in that person's blood?
But
it's not saying that this was the cause of agent.
So the classic thing that they do, so about 2/3 of drug-caused deaths are polydrug. So that's why these counts are going to far exceed the number of deaths. It's the number of the times the drugs are identified. And I spend a lot of time in a medical examiner's office. And essentially, if there's a meaningful level of a drug, they're just going to roll them all together. Acute intoxication due to the combined effects of blah, 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 blah. And they don't try to differentiate out, well, the sleeping medicine may not have done it, but the cocaine really did it. They really are basically saying, you know, there's going to be an additive effect. I can't distinguish what's going on with this person. I don't know their tolerance. I don't know a lot of different things. So this is a crude measure, but it gives you a sense of kind of the scale we're talking about and the variability.
But the starting point is people
Yeah, so these are all drug-caused deaths. These are ruled as drug-caused deaths. Thank you. Yeah. So why wastewater treatment plant drug testing? Rationale and some methods. So this is what a typical plant looks like. I've only gotten to go to a few, but they're lovely. They're very focused. You're sampling at a single location for a municipality. That's pretty awesome, right, for me. The least amount of degradation. You don't want to be going to the other side of the plant after they've treated everything, right, because they've just treated it and you've just lost everything. Preserves privacy of individuals. It's funny, Jennifer, this is Jennifer's slide. She said important in the US. Actually, I think it's maybe more important in Europe, but that's fine. I don't know where it's more important. I don't know where it's unimportant. I don't know. Samples are collected daily and monthly, really inexpensive, and you have known flow. So I'll show you in a minute, but you end up with a measured concentration of a substance of interest, and you know the flow, and you can add per capita, and you get a per capita estimate of excreted substance, which I'll show you in a minute. But very importantly, I don't know if it's on the next slide or not, the idea is that these treatment plants already do this. They have to for environmental regulations. They have to measure what comes in the plant and what leaves it, because they have to look at removal efficiency. So they got a nice big 5-gallon bucket of a day's worth of water, and they're pulling out. They're doing flow composite sampling. So they're already doing all the ideal sampling to get a daily estimate. And we're just saying, can we have 100 milliliters of that, please? So some of the attributes of this data, they cover much of the population, generally speaking, not septic. I'll show you that in a minute. We have known catchment areas. The municipalities know exactly where their lines run. They generally follow political boundaries, but definitely not always. And that obviously aids looking at other data sources, and it's more useful for local planners, public health and other folks. And usually you can get good GIS shape files, mapping files from the local municipalities, and you can then line that up with other data you might have. It's extraordinarily drug specific. It's analytic chemistry. You know exactly what compound you're looking at. It's timely. It's available with a short lag. I've probably never gotten data with less than a month turnaround, but if there was some outbreak of something, there's no reason it couldn't be much quicker than that. It's time scalable. We've actually done studies within day to look at variability of substances over the course of a day. That's a lot of samples. That's a lot of analysis. It's not something I would do just for fun, but it can be done if you have a particular research question. And in day, and obviously then you can just aggregate up or do sampling to try to get it month and year. And then geographically, you can scale up as well. I'll show you with King County, it's actually a little bit messy in terms of the number of different catchment areas. So you might want to aggregate to get an area that would line up with some other data source, or you could go upstream, although that's where the ethics get much more tricky as you start going upstream from the plant. So this is just an example. Yeah?
You haven't said anything about the cost. How expensive are these things?
Well, the problem is that I've only done it in the course of a study. So it's hard to rapidly just say it costs this much. I'm actually trying to get that cost estimate from somebody for a grant I'm putting in right now. But I mean, we're talking, you could get an annual estimate run for a city for a few $1,000s in terms of the chemistry. I mean, like a couple $1,000s. It's not a lot of money. And depending how you pool that sample and the level of resolution you wanted, it could be cheaper than that. Okay. So as an example here, I just plotted what are the wastewater treatment plant catchment areas in gray, and then residents where people live. Each dot's 1,000 people, and there's an 85% overlap. And that's by where people live. And you could also imagine that these people may well be contributing when they come in to these areas as well. So they're not totally unrepresented, but about 85% coverage in King County, as an example.
How does that compare to the other counties?
It's going to be all over the map. It's going to vary a lot. I mean, there's some places where you might even have more denser, better coverage, and places it's going to be really quite diffuse and bad. So this is an example. Each one of these, so here's Seattle. This is actually the cleanest. This is Seattle's catchment area, and it's like 90+% alignment with the Seattle political boundaries. You can see a lot of different, each one of these is a different area. And you can generally get data for those places if you want. There are some issues where the Seattle plant out at West Point basically catches Seattle, but the Renton plant catches the whole east side. So there's ways you could say, well, I'm going to go upstream and I'm going to take advantage of this junction and I'm going to do sampling there. But I'll explain very briefly that these plants have automated samplers. Very easy to pull a sample. As soon as you go upstream, you're getting a portable sampler, a portable flow meter, a human being, a traffic control plant. It's a pain in the butt. I know because I tried to do it last week for Freak Night. So it's not easy to go upstream. It's doable. It's generally done for things like, well, is this aluminum smelter in compliance or not? Okay. Did you guys all go to Freak Night? Okay, so some of the recent research. So some of the stuff out of Italy has come out, and there's most of the articles now, and the articles that are no longer getting accepted are basically, hey, look what we found, right? Look what we found, look what we found. Hey, we found it too, we found it, right? So, and they're showing inter-city and inter-day variability, very limited discussion of the nature, sources, and the implications of the error on estimates. They're doing lots of back calculations. One of the first studies that came out, I think in 2008, out of Italy said we measured the river water, and adolescents are using 4 times as much cocaine as we thought they were. So that's a big envelope to do that back of the envelope calculation on, right? I mean, there's like 48 steps in there. That's some serious extrapolation. So I had some concerns about some of the quality of those data, and what's shocking to me is that I actually get flown to Lisbon to be the social scientist to talk to the environmental chemists. These are almost all environmental chemists talking to each other. And so there's a lot of education that's going on with these folks around. It's pretty surprising that they just report analytic error, they don't have confidence bounds. So I said, oh, you might want to incorporate some confidence bounds. Oh, okay, so this year I went to a meeting, look at all those great confidence bounds, completely ignored when interpreting the data. So there's more education to do. It's sort of building up, which is, the analytic chemists are like, well, I measure this, here's the degree of 3% analytical error, I'm done. And I don't think that's right. So this is an article sort of on the other side of things where they're trying to go, and this is just an example. So Kevin and Sarah in particular, and Barbara's got to be on there somewhere. There she is. They're basically trying to, across Norway and Italy and the UK, which is where they're all based, create essentially a European system where they're trying to track wastewater. And they've also just got a large training grant, about a 5-year training grant that I'm an external consultant on, to basically help develop this methodology and train a bunch of doctoral students in these approaches. But they also are, unfortunately right now, they're just doing 1 continuous week sample per year and then reporting that. And there's a paper that will be coming out soon that basically is like, that is not how you generate an annual estimate, is to take 7 consecutive days and say it represents 365 days, for example. And I'll talk more about the sampling in a minute. So it's getting there. I don't think I have my slide in here. It's got the Homer Simpson sort of evolving thing. I think we're in our adolescence. You know, this methodology works, so we're finding really the statistical piece of it. The chemical piece is not as bad as the statistics, and the statistics are pretty easy. If I can understand them, they're pretty easy. So European Monitoring Center is supporting a lot of these meetings and really trying to support moving the state of the science forward and putting out publications and hosting meetings, which is terrific. Because the nice thing is what they do have is they have lots of nice external validation data to use. So that's a great group to work with. So very brief on a chemical analysis, mostly because I don't understand it. So that's not entirely true. But as I mentioned, so we're getting 24-hour flow normalized composite samples of raw wastewater. Just to mention very briefly, there's different ways you can do a time composite sample, a flow composite sample, and the intervals actually really matter. If you're sampling once an hour, you could be missing something really interesting. At the same time, sampling continuously gets really expensive. So there's been some work with Christoph Ort, who's a wastewater engineer, who I never knew I'd be working with a wastewater engineer, but I am. And he's terrific, and he speaks English better than I do, and can explain things to me very well about how to optimize your sampling. And that's really, really, really essential here. You don't want to be missing pulses in your stream. Okay. So basically getting a small sample, about 100 mils. You don't even need that much because you're really only going to use 6 mils. And they're basically, the level of quantification is generally around 10 nanograms per liter, 10 parts per billion. Okay, so that's pretty good quantification. Precision is generally much closer, lower than 10%. And matrix effects is a fancy word for using poop water instead of blood. I learned that. It took me a while to learn that. But doesn't that sound good? Matrix effects. So there's all sorts of ways to account for that internally. These aren't even puns. I'm just saying it straight. And this is the type output you get, which you would expect. And the main thing that really matters here is these levels these are pretty high levels. This is Corvallis. So again, I said we got quantifications at about 10 parts per billion, 10 nanograms per liter, and you can see a lot of these are well above that. Methamphetamine, for instance. Please.
This might be a really ignorant question, but I don't know a whole lot about what level of these drugs is effective and like your body physically. Is there a way to standardize recognize this, that this means more to me in terms of which is actually being used more.
Yes. So what? Is that your question? Like, how much drugs are we really talking about?
Yeah, like, does that,
Yeah.
is that really people, as just many people getting high on cocaine as many people getting high on amphetamine, but you need more amphetamine than you need cocaine?
So great question. Methamphetamine is 50% unmetabolized. That's pretty important for the levels you're going to find. And when you're doing back calculations, you need to know 50% methamphetamine is unmetabolized. And you need to know that you don't really want to look at cocaine, you want to look at its unique metabolite, benzoylecgonine. And you can see the ratio right there, and there's a couple of different reasons you want to do that. I'm not going to go into all the chemistry because it gets really complicated about what happens around benzoylecgonine, reconjugating, doing all sorts of stuff in the wastewater streams, but some of that work has been done. Some of it still needs to get done to really tighten up some of the estimates. But the point of all this is to ultimately go back-to-back calculations. Personally, what I'm reporting when I'm doing my work is the excreted concentration. So I can say, here's the average amount excreted per population. I'm not trying to do the back calculation to the number of people. Everybody else is doing that. I think it's hard enough just to do that well, so I'm kind of stopping there for right now.
Which would still allow you to look at time.
What's that?
So it would still allow you to look at time differences. Like you can't compare between drugs as well with that being that.
So you're saying time differences like within day?
Over time, like over years.
Oh, yeah. So, I mean, there's a bunch of statistical issues that come up in terms of comparability across place and within place. And we always have longitudinal within place because it fixes so much of the confounding issues. And so that's pretty clean. The issue is the comparability across place. And there's all sorts of issues that come up. And some of them become almost economic type issues. Doesn't matter if they have 70% pure heroin in New York and we have 4% pure here, do human beings try to get the same amount high? I would say yes, because they're human beings on average. So that would be my guess. So, but it's things like that. So some of that is, we can go out and test these, and some of that is, well, you need to think that one through. Yeah.
Can you just explain what are those peaks?
So these are just each of the unique identifiable peaks that identify that compound specifically. So that is the peak that would uniquely identify benzoylecgonine. That's it. Nothing fancy. I mean, yeah. It's just that you can identify these unique peaks and that they are associated with a particular compound. Okay. So then there are issues around urinary biomarkers, and so calculated loads can't account for changes in population. This is actually the biggest deal. This has taken me a couple years, and I still don't have the answer, and somebody in this room is going to have the answer for me. You have it in you, I know it. And that is that, if you just go out to the edge of town and look at the population of Seattle, that's kind of a problem because the population of Seattle is always changing. And it's definitely not what's on the sign. So it would be nice to have an internally directly measured compound that was representative of the size of the population. And we're trying to nail that down. And some of that is when you can get something that's closer to a small study, like a prison where you know how many people there are and you're just trying to measure what's the creatinine and look at how tight those correlations are. So these are just a couple of different anthropogenic biomarkers: nicotine, cotinine, caffeine, and creatinine. And there's different issues with each of those. Still trying to nail that down. I'll talk about it in a little bit more. What we need to do is have some measure of variability and direction of bias we expect for the population estimates because we know they're not right. And these may work, and we don't know how well. So very briefly on a statistical analysis, just the most basic measure is what's the concentration, what's the flow for that day divided by the population, gives you the average per capita excreted per person. That's it. So the plants measure the total flow every day. They have to do that. This formula assumes a static population. And again, attempts to back calculate the number of users assumes all these are sort of steady state functions, all of these different things back here that we know are not necessarily true. They may be more true within place, but they're not necessarily true. And I always say this is a crude measure, and I mean that in multiple ways. All I can do is tell you the amount of drug in a place. I can't tell you who's using or how they're using or why they're using. That's actually my favorite thing I get rid of is all of the attributions about why people are using that the environmental chemists put in when they're reporting the drug use. You cannot tell me why people are using drugs by looking at wastewater. You can tell me that they are. Yeah?
I'm just curious, do you exclude peaks, aberrations that might be, say, a bunch of college students going to a campground for a weekend party, and there might be a lot of drug use, or a concert or something like that. So I know you haven't gotten to showing your output yet, but if you found an aberration, would you exclude that?
It depends what my question is, but almost definitely not. So if my question is event-based, and that's an event, that might be exactly what I'm looking for. If I'm trying to create an average annual estimate, like in my most recent study, we have a stratified sample that's stratified on quarter of season and stratified on day of week. So it's going to be one of 56 samples during that year, and I don't want to exclude that. That's part of the variability that I want that are inherent in the data. Yeah?
Do you have to worry about the relative stability of these drugs in water?
Yeah, so the question was about the relative stability of the drugs when I'm breaking down in water. Yes, you definitely have to worry about that. I'll come to some of that a little bit later about what are the attributes of sort of a good drug versus not, or a good target. Yeah? Is there another one?
Does that matter in terms of wastewater treatment plants that are much farther downstream distance-wise?
It could. Right, so that was a nice example when you can go to a prison and say, well, we're 100 yards outside and we're going to measure creatinine, we're going to measure degradation and ratios of metabolite to parent drug, and then try to get downstream. So there's still some of those questions that need to get answered, but absolutely. A place with a 10-hour retention time is going to be very different than a place with an hour of an average sewer transit time. Yeah. Okay, so really important, and I didn't realize it was getting ignored until I got a lot of data myself and I realized that everybody else was ignoring it. A lot of results are going to be below the limit of detection. You can't find it. With a level of quantification, you can't quantify it. And what I didn't realize is that all the environmental chemists were throwing away those data and ignoring them. I'll show you in a minute that, of course, those data are information, and they should not be thrown away. And you can't quite see this, which is the best part. This is Non-Detects and Data Analysis, NADA, by Dennis Helsel. It took me 2 years to figure that out. The book was sitting there. I talked to Dennis. I read the book, and then it all of a sudden occurred to me. So he's actually a former USGS statistician. Who looks at exactly these types of issues. And so I don't want to bore you with all this, but it's a really important issue, and I'll show you why in a minute. And so I was basically going over and talking to all these environmental chemists about survival analysis, which is just not what I thought I would ever be doing, but that's what I needed to do. And yeah, so well, I'll just say, you're going to see some of the distributions of the data in a minute, but it really, really matters. You have some compounds. I'll just give an example. So in the 20 cities we tested in Washington and Oregon in 2009, Seattle had ecstasy or MDMA on 95% of days, and some town, I don't know, Hermiston or someplace like that, had it on 5% of days. Well, it's pretty hard to calculate a mean and a median if you only have 5% of your samples with a result, right? And so depending what your comparison is, within place or across place, it may be that all you can report are the proportion of samples that have a quantifiable value. That's it. And that's information. It killed my chemist when I did that to her data. And you'll see later here, I just categorized her data. And she's like, but I got you 5 decimal places. I'm like, I'm really sorry. I'm categorizing your data. So we'll get there. And we'll get there. It might take 10 years, but that's what we had to do. Okay. So incorporating these error components is another piece. So the sensor data is a big deal, and actually building up at least partially a complete error term. So you have analytical error, which is pretty small. Flow error, which is pretty big. Sampling error. So sampling error, and this is what I'm working with Christoph on, and he's got his model, his model that he runs in R that basically is saying if you're looking for this compound and you might expect something like this level of use and this amount of excretion, and you're sampling at these intervals, what sampling error are you introducing by not doing continuous sampling? So you need to account for sampling error. So I just mentioned if you're sampling every 15 minutes, that's not continuous, that's every 15 minutes. So you need to account for sampling error. And then population estimate error. So I spent a couple years wandering around the UW asking somebody to help me with this. And then I found out that demographers and sociologists think on migration in terms of decades. And I wanted to know within minutes or hours. So we still have a little problem there I'll come back to. So in the short term, what I basically found was an okay measure that tells me what I would call the direction of the variability. And that is that you can get some data from somewhat old census data that says, for instance, it's called a daytime population estimate. And so they take the population of a place, where people live and what their migration patterns are for work, and they calculate an average daytime population, the size and the direction. And so for instance, I think that 31% I think was probably Olympia. But you can imagine seasonally, it's a lot bigger than that. It's probably 100% in Olympia. So this is at least to give a sense of the direction and the scale of the error. At some point, I would actually like to not just have an estimate with error, but maybe get something based on my smartphone that tells me how many people are in a catchment area on a certain 24-hour period. So this is just an example. This is actually a point estimate that was generated with a censored approach and just built up the error bounds. And what you basically find is that this estimate is plus or minus 33%, which also made the chemists freak out. They freaked out, right? And I said, well, you know, if you're talking about cocaine and you do a national survey, you'd say that cocaine use is 0.3% plus or minus 0.3%, right? So I have a really narrow confidence bound around a totally invalid estimate. So I would happily take a big confidence bound around what I think is a more valid estimate. And they kind of got that. They kind of got that. They don't love it, but they kind of got that. So that's kind of where we're working in terms of some of the statistics we're putting together for it. And then here's another way to look at this. And this is, to me, sort of the essential data comparison problem. They keep asking me, can you compare to epi data? I'm like, well, sure. But you have to address this problem, which is that wastewater is the total population. That's what's awesome about it. But basically, everything else is not. You know, you do a household survey, and you're missing the high-frequency users. You do a jail survey, and you're getting the highest acuity users. Or your areas just don't line up well. Does that make sense? It's just very hard to find directly comparable data. And are you measuring consumption of a drug, or are you measuring consequences of a drug? Those are different things. So a little bit, some findings from Oregon, mostly just because I had pretty maps made. And so I will tell you, actually, I tried to get this paper in AJPH as an example of the confusion on this, and it kept getting sent to an environmental health editor, and he kept telling me this is a bad measure for point source pollution analysis. He kept saying, and I kept saying, could you please read the abstract? I beg y'all, just read the abstract. And he kept saying no. So it's in addiction, which is fine. I would like to have gotten it, you know, to this audience, to more of a public health audience a little while ago. And the good thing is that they're very precise about drug names. So it's the longest name of an article I've ever had. And I now know how to say 3,4-methylenedioxymethamphetamine without even looking at it. So that's exciting to me. So this is just basically a very, very simple paper. Like Jennifer called me and said, hey, I can measure these drugs. And then she sent me some data. And I'm like, I don't know if I believe this, right? So I basically looked at 3 drugs, cocaine, methamphetamine, and MDMA, and I know something about what I would expect to be drug use patterns, and I had some hypotheses around urban and rural place. Where would these drugs most likely be? And that's it. That's the entire point of the paper, is sort of how do these data plot out with what my expectations would be around place. So these were just 96 samples. This was one day. This was not a good way to sample. This was 96 samples. This was back in 2008. Totally voluntary. Some people actively said, no way am I going to do that. No way do I want people to know how much methamphetamine we're using, right? That might introduce some bias. I'm focusing here just on 3 stimulant drugs. It's just easier to talk about 3 stimulant drugs. And I just looked at very simple categorical distributional tests between load patterns in rural and urban place. So this is 96 cities, 2.5 million people. It's 2/3 of Oregon's population. City size range from 170 people to more than 500,000. And you can see the distribution. 36 were urban places. This is the rural urban commuting area codes. 26 were large rural cities or towns. And 34 were small rural towns. So you get lots of good variability there and pretty decent population coverage. So this is one of the ways we reported the data. Remember I told you I turned them into categorical data. So this is MDMA. And what I did, because this is the first time I had seen these data, it was a single day sample. I was not comfortable at all trying to generate point estimates out of these data. So I just basically just looked at the distribution of the data. Was it below detection, which I think is information? Is it below quantification, also information, and then just a distribution of the data. And so what you basically would say is that in urban areas, 50% of the samples were positive for MDMA. In these large rural cities and towns, it was a little more than 20%, pretty similar for these small rural towns, but different distributions for the below detection and below quantification. That's just the distribution of those data. Here's the same data mapped. So the gray is just the rural urban place, and the X's are nothing's detected, the black dots are below detection, and the circles are just scaled to the level, the tertile of the data. Okay? And so you get a sense of the pattern, the distribution of the data. And then these are this is just comparing the cocaine metabolite, which I think we found in 80% of towns, MDMA, which was less than half, and methamphetamine, which was in every single town. That was actually the most interesting one to talk about with media. And this gets to sort of my little larger agenda was sort of whatever you think about drugs and drug abuse, having good information is a good thing. So it's pretty hard to point the finger at somebody else when methamphetamine's in every single town. And so that was interesting. And then the reporters kind of riffed on that a little bit. So I thought that was pretty interesting. And then basically, cocaine. This is just a basic chi-square, just looking at equivalency across place. And this is, I think, a Pearson's order chi-square, just looking at the trend across place. So cocaine clearly had a bias, or not a bias, had a directionality, much more likely to be in urban places. Methamphetamine is ubiquitous. It was everywhere. MDMA was not significantly different across place, but there was a trend towards it being in larger areas, just as an example. So, and this very well aligned with what my hypotheses would be around these drugs. Okay, so basically the correspondence, basically in terms of the hypothesis and my expectations, suggests that these are actually valid data. They're not totally random noise, which is great, because that was actually a pretty bad sample of one day, so I was probably lucky. And so I think these data have the ability to improve the measurement of the true level and the distribution of a whole bunch of different types of drugs. And they provide information for all people in a community, and they're therefore applicable to a much larger proportion of the population, not just across the whole state, but within a place as well. You have much better population coverage. I don't think I have a slide that says this, but I would also say that I would never think to try to interpret these data in isolation by themselves. They're just one data source. They are a really important complementary data source, but by themselves, I would be very wary of trying to interpret what's going on. So a couple of things, So a couple of things here. So we're wrapping up analysis of another study, which is 20 Northwest cities, for which we did that one-year annual estimate. And basically, I got really bogged down because I didn't even have a statistician on the grant. I didn't have a wastewater engineer on the grant. I didn't have a demographer on the grant. I didn't have anybody in the grant I should have had on the grant because I didn't know what the data looked like. But I found them, and we're doing it. It's just taking a little while. So we're basically wrapping that up, and then also trying to convince the general audience of researchers that these statistical methods are appropriate. And then what I'm in the midst of is putting together a national multi-year surveillance project that I'll talk a little bit more about. So the idea with this, I'll just mention, is sampling, creating annual estimates of drug consumption, and I say 20 plus 20 cities. As I mentioned, I'm the Seattle representative to a national drug epi work group that has 20 cities. And so there are people kind of like me in all these places already generating data and working with the data and communicating with the public about them. So what I'd like to do, this is not trying to create a national estimate, but it's trying to get some pretty broad coverage and get a lot of variability. So what I'm hoping to do is have basically those 20 cities sign on where I already have contacts and where they already have data, and have them pick a small heterogeneous community in their same state. Not just from a data perspective to get variability, but also from a feasibility perspective, can you ramp this up and really scale this up in a large way? So then the idea is also bringing in sort of a national expert work group of people from FDA and the DEA, the Drug Czar's office, NIH, some of the different private labs, poison centers, CDC, all these people, to hear what are the emergent issues. And if we need to, scale up rapid investigations. So we see a new community that's really got something on, we could scale it up there. Or we have one of the communities we're tracking already, and we decided, you know what, there's something big going on. We want to do 30 days consecutive sampling and figure out what's going on so we can really understand the dynamics. We need, with actually a number of scientific questions we still have, we need to do some design studies around the population estimate, the sampling and the testing protocols. You know, for instance, 56 samples for a year, that gives me an annual estimate. What happens if I pool all those into one big sample and run it once? What happens to the point estimate that comes out of that pooled sample versus 56 separate samples? Save a lot of money, how much information loss is there? The population estimate, I was at a talk at CSSS last week talking about using, what was it called? Well, they were using there was basically daytime travel surveys and trying to align it with some cell phone records. And it was really quite messy because the cell phone records are quite terrible. And so you have to go to each cell phone company separately, you have to get the data, you can't disclose them, they won't actually tell you what the data really mean, it's kind of a problem. So a nice aggregator of that, of course, is Google or Microsoft or people like that are actually really trying to track this and synthesize it for another purpose, which is, well, where's the traffic bad? But it also tells you where the people are. It's just another way to look at the same data. So I'm very interested in trying to get that figured out sometime in the next 5 years would be nice. And then the actual utility of the data, this is just hands-on feasibility. So I'm an epidemiologist. I worked with these data for 8 years, but my colleague in Austin, Texas has never worked with them. How do I train her on how to work with them, how to interpret them, how to talk to media about them, how to integrate them, how do you integrate them into a drug index, that type of thing. So just that real utility of how to use the data. So that's what I'm thinking about, and then I'm going to go through a couple other examples. So in thinking about what you're interested in, some things to think about is what is the target analyte? So, okay, I'm interested in cocaine, but cocaine is mostly metabolized. There's actually a metabolite I want to look at, for instance. And what does it represent? And the really hard thing, at least for me, used to working with individuals, is what does it represent at a population level? It's one thing to say what's the ratio between cocaine and benzoylecgonine in an individual. What does it mean at a population level? So just trying to zoom out, those things it's different. This is 2 million people, this is 1 person. How do I interpret these data? It's different. And thinking about issues around degradation, just the literal decomposition of the drug, or metabolization, turning back into the parent drug as a metabolite. That's a little tricky to deal with. What loads are likely to be present? Is it 1 nanogram? Is it 1,000 nanograms? Is it 100,000? How much of this compound do you expect to find? Would it even be possible to find it? And then the chemical structure may impact the analysis in terms of just what phase you're going to run the chemical equipment in, or you can need to run 1 pass, 4 passes, so on. So this is some of the chemistry that has to get figured out. And yet, as I've slowly learned, you really need people who know chemistry, toxicology, engineering, medical and public health, practice, the real world, how things are actually happening. Pharmacology is nice, and everybody loves a good epidemiologist. So you at least need that group of people. Well, after I talked to AB last week, I'm sure I need a mathematician too. Which I had been thinking when I was at CSSS, and then he called me. Perfect, I needed one of you. So just a couple examples. I actually put in an NIH Innovators Award in 2009 saying, hey, can I have 5 years and some money to play and see how else we can use this? And of course, one reviewer said, sure, and the other one said, this is terrible. So they don't take the average. So let me just give you 3 examples, just to tell you some of what we were thinking of. For instance, you could look at medication utilization. So you could look at community utilization of medications. It can be tracked over quite time interval and with very little data lag. This was back when all the Tamiflu was being given out to everybody, and we wondered if people were actually using their Tamiflu. Was that the 5-minute? Yeah. So that's just an example. So it could be something like that. Is a medication that's being prescribed and dispensed actually getting utilized, and when is it getting utilized? Oh, no, I'm going to go back because there was something else interesting in here that I didn't know at the time. So the measured excretion levels could inform infectious disease response planning as well as surveillance of the substance with potentially negative effects on the aquatic environment and wildlife. In the case of zoonotic diseases, there's the potential for the medication-resistant strains to circle back through, right? So it's a whole life cycle consequence. So it's trying to look at that. Another example is around nutrition promotion, right? And this is basically, well, can you look at phytochemicals? Can you look at sulforaphane, which is this unique metabolite of broccoli? Can you actually look at dietary consumption among people as opposed to using food diaries? And another example is just straight up looking at the impact of pesticides and herbicides. They're widely used, result in human poisonings and toxicity to the environment. And there's just an example from Oregon. Fipronil is a widely used insecticide, and it's the leading cause of calls to the poison center in Oregon. And it's got a whole bunch of bad stuff in terms of being a potential carcinogen and a suspected endocrine disruptor. So data about community usage levels could be used to inform public health promotion campaigns to improve human and environmental health. One of the other things in my world and in lots of different worlds I think is interesting around wastewater, I think it's good. I think it scares some people. If you want to measure the impact of your intervention, this is a pretty good way to measure the impact of your intervention as opposed to self-report surveys or something like that. And you can do it in quite tight time bounds. So that's it. That's what I have for you. Just want to pique your interest. Hopefully I did that for some of you, and I'd love any questions or ideas or anything else.
How does your data, especially the MAP data, compares with the fatalities that are reported?
So in Oregon, the numbers are pretty small, and in most places, the numbers are going to be pretty small. So, I mean, one of the aims of that study is to look at the correlation with some of these other measures. And we did a little bit around cocaine and methamphetamine, and the correlation is pretty good. MDMA, almost nobody dies of MDMA overdoses. So that wouldn't work so well. And there's been some, a colleague in Norway has also tried to do some validation with roadside driver surveys, trying to get at a decent population estimate, and there the correlations were pretty good. They were trying to get at the level, they were actually really trying to get more at actually the level of use than the geographic distribution. What we've seen so far is pretty good, but the comparison really matters. The mortality may or may not be a good measure. As I said, some of these drugs have very low lethality, even though they may have other sort of morbidity consequences. Yeah?
Do you have an idea of what groups of people are driving these concentrations you are measuring? This is particularly interesting when you're doing evaluations, of course, because you have a small impact on the large group of habitual users or a small group of high intensity users.
So it's a huge question, and it kind of relates to that picture, right? You could have small people driving this. You could have a small number of people driving the data, or a large number, and you wouldn't know which. It's not entirely true, though. There's some ability. So around here, if you look at methamphetamine, just as an example. So methamphetamine, I look at methamphetamine across days of the week completely flat. We have endemic use, we have addictive use, we have a lot of use. You go to Chicago, from what I know from my epi colleagues there, we haven't measured the wastewater there. They barely hear about methamphetamine except among the gay party scene in one neighborhood. So I would hypothesize that they're probably going to have a big peak when a wastewater hits the plant on Sundays. So there's a little bit you can tell from the temporal patterns about sort of the level and nature of use within a community. Again, very crude, but it would give you some little insights into that. Yeah.
Yeah, it's related. I was going to ask if it's fair to interpret you as to say that these data currently are useless for prevalence estimation. Is that true for all the drugs, and you think? So
I think the data are good for prevalence estimation. I think you have to get a proper annual estimate, and you have to treat the data correctly. You have to do the appropriate statistical treatment. So I do think they're fine for a prevalence estimate. I haven't made myself comfortable and done all the math to work it back up to actual consumption as opposed to excretion. It probably doesn't really matter that much. You can still get a general sense of this represents roughly 500 doses of standard cocaine, something like that. So we can certainly make those comparisons.
Yeah, you still have to then make the jump how they distribute the doses.
Right.
And for methamphetamine, which is highly addictive, it's probably not such an issue, but for cocaine, which is used much more interruptants over time, it will be much more.
So make sure I got that, because there are different typical days of use patterns. So a person coming into treatment for methamphetamine is generally used 23 days out of last month, cocaine 10 days. So you just have some temporal patterns of use. But your point was what? I'm not quite sure I got it.
Okay, so yeah, that's sort of additional information that will help you back on it.
Right.
So you also would have to make assumptions about the average amount used per person.
Yeah, so you got an average dose, you've got the route of administration, which can vary greatly. Yeah, average route of administration, here's the bioavailability of it, but you just burned half of it up into the air, so how much is actually consumed and processed in the blood? So that's why I start getting very concerned about it. Yeah. I'm going to go there anyway.
I wonder, and this is just sort of thoughts as I'm watching, as I'm listening. Are you going to be doing time series analysis in your sites, for example, so that you can look at the population change over the course of the day, and then you'll be able to correlate what nanogram per liter change is maybe correlated per person? So then I wonder if there might be something there where you could calibrate and then pair that with some sort of a survey that then would tell you, okay, this much drug use in this setting results in this much change in our indicator.
I think we need some of those studies. I mean, I think we need some of those design studies on sort of a small scale to look at how tight that temporal correlation is and what the implications are. Can we essentially add information by externalizing within the data source? I think that's very important. We've done some work within DAY trying to look at the sense of, are we getting a migration impact? Are we getting people coming into the city? Are we seeing a bump in a level of creatinine? So we're doing some of those kind of micro studies. That's much more in kind of the chemistry and engineering side, but trying to think about it, and I'd love to hear more about how do you use that to actually think about how to interpret these data down the road. Yeah, there's a lot of those pieces in there. There's a lot of information out there, and I think trying to get the most out of it is what I'm still trying to figure out. Yeah.
How good does the wastewater management system has to be in order for you to collect the information? Let's say you want to apply in a developing country.
Right. Great question. So how good does a wastewater treatment plant have to be in order to do this? So, I mean, they essentially have to have the ability to generate some sort of estimate for the day. And it may be, and this is actually, I was looking over my old application, some of them may not have good flow meters. So you would actually want to do some design studies where you put in a flow meter, use their standard approach, use your flow meter, and see how good it is. It looks like you probably really need a 15-minute sampling interval. So you can't just be randomly having somebody sit there pulling this. This is a machine has to do it. And so most places end up having big automated machines. You could get these portable samplers, but you do need some ability. If they're doing a waste treatment plant, I don't know what environmental regulations are like in different countries in terms of the requirements on plants to look at removal efficiency. I would think that's probably a pretty big precursor would be having a regulation that essentially makes you do it. I don't know why they would do it otherwise. You could go in and say, I really want to look at this question, and I'm going to bring in a portable sampler, and it's not a huge thing to do that. If you had an important question, you could certainly do that and implement it, but that's kind of the technology issue. Yeah. The question in the back, and I'll come back.
Is it possible that concentrations of these drugs are ending up in wastewater through avenues other than consumption? Something to do with production or disposal or anything?
Yes, and a very nice study was done actually in, I think it was Amsterdam, of course, around MDMA, and they got a weird peak, and they were actually able to look at the stereochemistry and look at the racemic mixture of the compounds and figure out whether this was sort of raw product or whether it was metabolite. And it turned out that this big spike was on the same day that the police went and banged down the door. So they've actually, which I always say, that never happens. That's only Miami Vice, which was a television show a long time ago. Just letting you know that was a television show. So it doesn't happen that often. And again, I think it comes out in a wash if you really have an annual sampling campaign, those spikes. But they're also the flip side. There are ways to look at metabolites and compounds that would identify production and even production methodology. Yeah. Jason?
A similar question alongside events and whatnot. For the chemically uninitiated, what do honey buckets, the chemicals in honey buckets, do to these metabolites?
Well, you'd think I would know the answer to that, but you're wrong. I know the answer to that. Not much.
Not much?
No, not much.
So a big party or whatever, you're not going to lose data just to deal with the time lag when the honey bucket.
So in the UK, they have this thing called pissoirs. Doesn't that sound good? I don't know why that's in the UK. That sounds French to me. So basically these urinals out in public places, and they've sampled those, and they've gotten all sorts of stuff. Well, for the new and emergent sort of synthetic drugs that are literally getting made and shipped out every day out of China, and they're changing all the time because they're legal, they're illegal. That's what you want to do. You got to get upstream. Can't go too much more upstream than that. Yeah. So I wouldn't. Yeah. But so you actually can use those data. It's a pain in the honey bucket to do it, but you can do it. Yeah. That's a new one for me. I got to write that one down. That's a new pun. Yeah.
Yeah. So with the international community, how are the lab machines calibrated to detect drugs, for example, some novelty drugs from across the world?
Great question. So if there's a new drug, how do you know it's there and find it?
Yeah.
So there's a couple different ways to go about it. You can do high resolution mass spec, which I don't really understand, which you're getting like molecular weight to like 3 decimal places, and then you can go and look at the molecular structure and try to actually identify it. So you can go this high resolution route. That's a new approach they're talking about. What I'm actually working on doing is working with a big national lab. Actually, the forensic side is run by the former head of our state toxicology lab here, NMS labs. And the point is they're getting all the immediate requests from law enforcement about these new drugs, and then they're getting standards from DEA to create those new standards. So there's always going to be a little bit of a lag, but the high resolution testing can help you get very specific. And then you also can essentially, you could be sort of having a little data bank of frozen samples you could go back to once you know that the compound's present and actually know what it is and see when did it come on the scene and where did it come on. It's not the most efficient thing. That's not really anything an environmental chemist wants to do, is to go back through a bunch of stored samples, but you could do it. And there actually is a guy, Tic Tac Communications in London, And his job is to create a drug library, basically. And every single drug that comes on, he creates a standard, he's got an image of it, and he sells that to essentially law enforcement around the world. So I would just call John, I'd say, do you got any of this? For research purposes. Yeah, all up? We're good?
Yeah, I was just wondering if you could talk quickly about some of the administrative hoops that you have to go through to get these samples in the States. You know, like you mentioned that some of these wastewater treatment plants are like, no, you can't test that. But, you know, you're talking to, who holds the keys?
So I finally figured out the pincher approach, which is you go to the superintendent of the plant and you go to the lab manager. So you go to both at the same time, and you want them both to say they'll do it. Because if either one says no, it's not going to happen. So that's kind of my approach, is I go to the person who would actually have to pull the samples, and I go to the person who has to give approval, and I basically just do it at the same time. That's what I found works. And some places simply won't do it. Part of the stuff with Oregon is it had never been done in the United States before. And they were like, huh? Right? I mean, they were just freaked out. So it's like nobody wants to be the first one on the dance floor, but eventually build enough momentum that you start actually looking aberrant because you're not participating. So that's where I'm trying to get. Yeah?
So you didn't need any further go-ahead from other city officials or state officials?
Well, in a place like Seattle, King County, you need approval from lots of people.
Right.
But in a place like Aberdeen, they're like, now go ahead. But and I'm being flip, but I will say, and this is the last thing I'm going to say, is that when we released those 96 city data, we knew the media was going to go crazy with it. And so we spent a lot of time working with each of the communities, sort of giving them a media preparation plan about how to talk about these data. And we spent a lot of time talking about how do you talk about these data, what do they mean, blah, 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 blah. So I'm being flip, but it, of course, is very important. It's very important for any community. It's important for a tourist community. So we really do want to take care and talk with them about what that means. It's also really important, therefore, if you can get the entire state and not be pointing the spotlight on one place when there's no context. So that's what we tried to do. So, okay, thank you.